Krishna. So welcome to my YouTube channel. So we have the exam on Saturday, aiims norcet. So for that I would like to discuss very important topics from the nursing, all the nursing subjects. So the firstly we will discuss regarding positions. Okay, so which are the important positions we may get the questions. So the first one is a supine position. So supine position, it is a normal position for the normal physical examination. Okay, physical examination we can use this supine position. And next one is a dorsal recommend. So dorsal recommend position, it is just like a supine position. So the patient knees are flexed. Okay. So this is the patient and the knees are flexed. For this dorsal recommend position, we commonly recommend for the perineal care. Perineal care. And the next one is the pervaginal examination. So commonly we will use this recommend position for the perineal care and pervaginal examination. So the next important position is Trendelenburg position. So this Trendelenburg position will be looks like the head end will be downwards and foot end is the upward. So this is a Trendelenburg position. So commonly we will use this Trendelenburg position for the air embolism. Air embolism. So air embolism is nothing but when the air bubbles are enter into the bloodstream. So in the circulation, when the air bubbles are enter into the bloodstream and when it is reached to the brain, so we will use this Trendelenburg position. And also shock patient. So shock patient and hypotension. So in the case of hypotension also we can use this Trendelenburg position. And mostly cord prolapse. So in the obstetric cases, the cord prolapse. In the cord prolapse is nothing but when the cord is present at a presenting part. So during delivery or before delivery, when the cord is prolapsed from the vagina, so it is called cord prolapse. And so these are the indications we can use Trendelenburg position. So in the Trendelenburg position, we have the reverse Trendelenburg. Reverse Trendelenburg position. So reverse Trendelenburg position is nothing but the head end will be upward and foot end will be downwards. So this is the reverse Trendelenburg position and this one is the Trendelenburg position. So this reverse Trendelenburg position we commonly use for when the patient is having gastroesophageal reflex. Okay, so in the pyloric stenosis, we have the gastroesophageal reflexes we can see in the patient. Okay, so in this case we can advise the patient for the reverse Trendelenburg position. So the next one is the lateral position. So this lateral position we can use for the patient in the to promote lung and cardiac function. So most of the surgeries like right side or left side, for example breast surgery, okay, otherwise gastrectomy, and in some cases we can use this right or left lateral position. So this position we can advise for the patient when the patient is having the risk for the pressure ulcers. Okay, pressure ulcers. So that is nothing but bed sore. So when the patient is highly risk for the bed sore at a sacrum. So for this reason we can advise lateral position. And also when the patient is having pyloric stenosis, so in the case of also we can advise for the lateral position, pyloric stenosis. And next one is the mainly during seizures attack and air embolism. Okay, so when the patient is having seizure is nothing but fits. So when the patient is having the seizure, we can advise left lateral position, and also air embolism. So for these reasons, we can advise the patient for the left lateral position. So the next one is a main important one, Sims position. So this Sims position will be the patient will lie on the bed and anal region will be elevated. Okay. So the patient is on the prone position and anal region is elevated. So mainly this position we can use for the rectal examination. Okay, most of the rectal examinations and administration of enema and prevent aspiration. So for these reasons we can use the Sims position. And the next one is Fowler's position. So in this Fowler's position we have the low Fowler's and semi Fowler's, high Fowler's. So we will see what are all the purpose. So firstly, low Fowler's position we can use for the tube feeding, okay, to prevent the aspiration. And in the case of increased ICP, intracranial pressure, we can use the low Fowler's position. And the next one is the semi Fowler's position we can use for lung expansion. Okay, for lung expansion to take the more breath. And also we can use surgical site following surgeries. So when the patient is having undergone the surgeries related to the abdomen, so we can use this low Fowler's, semi Fowler's position. And the next one is a tracheoesophageal fistula. So in the case of child, neonate, when this condition we can see from by birth itself. So tracheoesophageal fistula we can advise a child for semi Fowler's position. And the next one is a high Fowler's position. So what is the use of this high Fowler's position? So mainly for choking. Choking is nothing but obstruction of the airway and respiratory distress and asthma. So these are the position mainly we can use for the lung expansion to take the more breath and to increase the oxygen levels in the blood, and also COPD and emphysema. And the next one is a pleural effusion. So for these reasons we can advise the patient for high Fowler's position. So in the Fowler's position we have the low Fowler's, semi Fowler's, high Fowler's. So low Fowler's will be the patient will be lying on the bed at 30 degrees angle. Okay, so in this is the low fallus, and in the case of semi fallus, the patient is having 45-degree elevation. Okay, this is the 30-degree elevation and it is a 45-degree elevation, and in the high fallus position, the patient is having the 90-degree elevation. Okay, this is the head end. Head end is the elevated at 30, 45 and 90 degrees. So the next one is the orthopenic position. Orthopenic. So these orthopenic positions we can use mostly respiratory disorders. So respiratory disorders like ARDS and asthma, COPD, emphysema, for all these reasons we can use the orthopenic position. So the next important position is the lithotomy. So what is the purpose of using this lithotomy position? Mainly for the childbirth. Childbirth is nothing but normal vaginal delivery. So in this position, the woman or the patient is lying on the bed and knees are up flexed and extension. Okay, so the position will be like this. So this is called lithotomy position. And also we can use for the pelvic gynecological surgeries. So for these reasons we can use the lithotomy position. And in the case of male patient, okay, male patient we can use transurethral resection prostate. So what is the meaning of transurethral resection prostate? When the prostate gland, okay, so you can think it is a prostate gland, this is the urethra will be passed into the prostate gland, it reaches to the bladder. So this is the bladder, urinary bladder, and this one is the prostate gland, and this one is the urethra. So this is the penis. So what will happen in this condition? The patient is having the swelling of prostate gland. So what will happen? The tube which is present inside the prostate gland, it will be constricted. So due to the pressure of the prostate gland, the tube which is present, urethral tube, will be constricted. So what will happen in the transurethral resection prostate? The scope will be inserted through the penis and they will remove some of the tissue which is near to the urethra. So this is the tissue which is present nearly urethra. They will remove it. So in this condition we go for the transurethral resection, and so for this reason we can use the lithotomy position. So the next one is the knee chest position. Knee chest position. So this knee chest position we commonly use for the sigmoidoscopy. So what is sigmoidoscopy? To visualize the sigmoid is nothing but when the large intestine, okay, so you may think it is a large intestine. This is a ascending colon, transverse colon and descending colon. So this part is known as the sigmoid. To visualize the sigmoid, this is the anus. So to visualize the sigmoid portion of the large intestine, we commonly advise the patient to take the knee chest position. So in the knee chest position, the patient will be lying on the bed like a prone position, and the legs are downwards. So this is a pelvic region will be upward. So this is the knee chest position. So the position will be looks like this is the, so these are the important positions we commonly keep in mind for the examination purpose. So the next important topic is the scales. Okay, so these are the scales or rating scales we use for the assess the effective, severity of the diseases. So the first one is the Glasgow Coma scale. So this Glasgow Coma scale we will use for the unconscious patient. Okay, to check the consciousness. So for the patient we use this Glasgow Coma scale for the level of consciousness. Level of consciousness. So this scale is developed by the Janet and Bond. So this person has developed Glasgow Coma scale in the year of 1975. So in this scale we have the 3 to 15 scoring. Okay, so this is the very important scale. You may get the question like when the patient is having the this kind of features the patient is having. So according to you, what is the GCS score? So you may get the question like that. So the next one is the Braden scale. Braden scale and Norton scale, and the next one is a Waterloo scale. So these three scales we use for the pressure ulcers. So pressure ulcer nothing but bed sore. So there is Braden scale and Norton scale and Waterloo scales we use for the pressure ulcer. So the next two important scale is the next important one is a cage. So this is also a type of scale, nothing but we call it as a questionnaire. Okay, cage questionnaire. So this cage questionnaire we will use for the patient who are having the alcoholism. So for this reason we can use the cage questionnaire, that how much he is dependent to the alcohol. So how much the patient has dependent on the alcohol, we can use this cage questionnaire. So the next important topic is the immunity. Okay, so in the immunity we have the two types. First one is a adaptive and innate. So adaptive immunity again divided into the natural. So this one is a natural and artificial. So innate immunity is nothing but the immunity that the person will receive from the by birth. From birth itself, the person will have the immunity, that is innate immunity. So adaptive immunity is nothing but we are adapting to the immunity. So in that we have the natural and artificial. Again in the natural we have the two types. First one is a passive. So passive immunity naturally we will receive from the mother, from maternal. So during the delivery or in the mother womb we will receive some of the immunity, that is nothing but natural passive immunity. Again in this we have the natural active immunity. So in this, when the person is affected with the infection, okay, so when the person is risk face the infection, what will happen when the antigen enter into the body? So our body will react towards the antigen to fight against with the pathogens. So what will do? The body will produce the antibodies. Okay. So for a specific antigen, we will have the specific antibody. For example, if the antigen A means, we will have the antibody A, and if the antigen B is, we have the B antibody. But B antibody will not fight against the A antigen. Okay. So A antibody will not fight against the B antigen, but it only fight against with the A and B. Okay. So this is the antigen antibody reaction. So what will happen when the infection enter into the body? Antigens will be present, our body will produce the antibodies. Okay. So these antibodies will present for a lifetime. So these are called natural active immunity. So the next one is the artificial. Okay, in the adaptive immunity we have the natural and artificial. So we will see the artificial immunity. So artificial immunity, we will have the passive. Again we have the passive and active. So passive immunity is nothing but we are artificially giving antibodies already. So in the natural immunity, we have the antibodies are produced by the body. So when the person doesn't have ability to produce the antibodies, what we will do? We are giving the antibodies to the body. Okay. So these antibodies it will have some expiry date. Expiry date will be present for a limited time, 1 year, 2 years, 8 years, like that. So these are the passive artificial immunity. And the next one is the artificial active immunity. So in this immunization, okay, immunization will come under the artificial active immunity. So you may get the question like this: the immunization, it is a type of immunity, that is nothing but artificial active immunity. So in the immunization schedule we will get the so many types. So all the vaccines are comes under the artificial active immunity. So the next important thing is the immunoglobulins. Okay, so immunoglobulins are A, D, E, G and M. So firstly we will see the immunoglobulin A, IgA. So this is the 10 to 15% of the immunoglobulins are present in the body, and mainly these are present at the nose, lungs and GIT. GIT is nothing but gastrointestinal system, tract, and ears, eyes and vagina. So IgA present 10 to 15%. It will present on in the nose, secretion, lungs, GIT and ear, eye and vagina. So the next one is IgD. So these are found in very small amount of IgD immunoglobulins in the body. Mostly it will present in the chest region and belly, that is abdomen. And the next one is the IgE. So IgE antibodies are present in lungs, skin and muscles. So most of the people are having the allergies. Okay, so when the persons are highly having most common allergies are affected, so in that patients we can see the high level of IgE antibodies. So the next one important thing is the IgG. So this IgG is present 75 to 80%. So this is called most abundant antibody in the body. So it is present 75 to 80% of in the body it is present, and these are very important to against, okay, to against fight with the bacteria and viral infections. So because of having 75 to 80%, we these antibodies are fight against with the bacteria and viruses. Those are nothing but pathogens. And main important character of the IgG is it can cross the placenta. Okay, so it can cross the placenta. So you may get the question like which antibody can cross the placenta, that is nothing but IgG. So finally we have the IgM. So IgM is found in the lymph. Okay, lymph circulation we can see the IgM antibody. So it is present about 5 to 10%. Okay, and so this antibody can present all over the body, and it has the big structure. Okay, this is called IgM, it is known as a macro antibody. Why? Because it is large in size. So next important thing is the anatomy. Skeletal system. So in the skeletal system we have the total bones 206. So we all know that, and in that we have the two types. First one is the axial skeleton, and then next one is a appendicular. Okay, so axial skeleton is nothing but comes under the cranium, facial bones and chest, okay, rib cage and vertebral column. So the skeleton, if you think it is a skeletal, okay, so you avoid the limbs. So what we have, skull and thorax and vertebra. So these are called axial skeleton. Okay, this is the center part. For the in the human body we have the center part bones which are called axial skeleton. So in the axial skeleton we have the cranial bones and facial bones. So how many cranial bones are present? Those are 8 cranial bones, and facial bones are the 14. And the next one is the hyoid bone, that is 1, and auditory ossicles. Auditory ossicles are nothing but ear bones. Those are 6, nothing but 3 one side, 3 another side. So in this we have to remember, that is the smallest bone, that is nothing but stapes. So this is the smallest bone in the human body. And the next one is the rib cage. So in the rib cage we have the 24 bones, 12 pairs. Okay, 12 pairs. And the next one is the sternum. So again in the thorax we have the Okay, we know that we have 12 pairs. Okay, so in the 12 pairs we have 1 to 7 are the true ribs. Okay, remember this one, 1 to 7 ribs are called true ribs. Why? Because the ribs are attached back of the vertebral column and in front it is connected with the sternum bone. Okay, so these are called, so this is the vertebra and this is the sternum. So these ribs are joined together with the vertebra and the sternums. For that reason these bones are called true ribs. Ribs are called true ribs. And the next one is a 8 to 12 are called false ribs. Okay, false ribs. And among in this 8 to 8 to 12 false ribs. So again in this 11 to 12 are called floating. So why we are calling this 11 and 12 are the floating ribs? Why? Because these ribs are joined with the vertebral column. Okay, so this is the vertebra. So you may think it is a vertebra, and these bones are last bones of the last ribs of the thorax. So what will happen here? Freely are movable. Okay, so it is only connected with the vertebra, but it is not connected to the sternum. Okay, they are simply leaved. So for that reason we call it as a floating. Floating means they are moving like that. And false ribs are, so these false ribs are not connected with the directly to the sternum, so they are connected like this. Okay, so these ribs are called false ribs. Okay, in the floating ribs we have no connection in front side, back side only we have the connect with the vertebral column. So these are the ribs. And next one is the vertebral column. Vertebral column. So in the vertebral column we have the 26 vertebra when you don't count with the sacrum. Okay, so if you count with the sacrum we will have the 33. And the next, so these are all of the axial skeleton. So we will see the appendicular. So appendicular is nothing but it is just connecting to the center part. Appendicular and related peripheral like that. So in the appendicular skeleton we have the shoulder bones, upper extremity, and next pelvic bones, and finally lower extremities. So these are all the bones will come under the appendicular skeleton. So in the appendicular skeleton we have the 126 bone. 126 bones are present in the appendicular skeleton. In the axial skeleton we have the 80 bones. It is total about 206. So next important topic is the spinal cord deformities. So in the spinal cord deformities we have the three types. First one is the scoliosis, and the next one is the kyphosis, and finally lordosis. So again in this we have the different types. First one is the scoliosis, is nothing but lateral curvature of the spinal cord, otherwise vertebral column, that is scoliosis. So in the scoliosis again we have the right scoliosis, otherwise left side scoliosis. When the vertebral column turn to the right side it is nothing but right side scoliosis. When it is turned to the left side it is known as the left side scoliosis. So the scoliosis vertebral column will be looks like. So this is a cranium, this is a vertebral column. So the person will be looks like this. And the next one is the kyphosis. So in the kyphosis, commonly we will see in the old age persons. The kyphosis, the vertebral column is curved to the back side. Okay, the curve of the vertebral column we can see at the back, and lordosis is nothing but the vertebral column is turned to the anterior portion of the body. Okay, anteriorly it is curved. In the kyphosis, posteriorly the vertebral column is curved. So the next important topic is the low deformities of lower limbs. Okay, so commonly we will see the people this type of deformities. When we see, we will commonly we will see very differently. So in that we have the three types. First one is the geno valgum. So in this genovalgum, the lower limbs are thighs are together. Okay, so these are the knees and this is the pelvis. Okay, the thighs are connected. So we don't have the gap in the between the thighs, but the lower limbs, I mean lower part of the legs are divided. So this kind of feature we can see in the case of genovalgum. That is nothing but knock knee. Knock knee means these two knees are connected. So this is called genovalgum. So the next one is the genovarum. So what will happen in this? The legs are totally divided. So this kind of features we can see in the case of genovarum. Okay, the patient will be looks like, so this is the pelvis. So we have a large or high distance between the two knees. So this is called genovarum. And finally, recumvatum. Recurvatum. So recurvatum, the posterior line of the knees are bent. Sorry, I am very bad in drawing. So this is the pelvis, and these are the limbs. So this is the kneecap. Again bad. So this is the knee, and so this is the foot. So this kind of feature we can see in the case of recumvatum. Okay, recurvatum. So posterior of the knees are curved. So these are the three types of lower limb deformities. So this is the end of my class, guys. After some hour I will continue with the important topics. Okay, important topics to be remembered for the aims norcet exam. So we have the only 3 days time to write the exam. Okay, I hope you all preparing very well. Don't neglect. Okay, in this time you have to cover all the subjects, very important topics. Okay, very important topics you have to look after. Thank you.